My name is Diana Hu. I'm a pediatrician at Tuba City Regional Healthcare Corporation. I decided to go into pediatrics because it's way more fun than adult medicine. Get to hang out with kids, see them grow, see them, move on to other stages of their lives, get to meet their families. One of the things that hopefully most of your families and kids know is that going to the doctor sometimes isn't fun, but we try to make it fun. And so trying to think of things that are fun and Make-A-Wish falls right in that list, especially for someone who has a chronic illness, that goes on the checklist. The Indian Health Service on Navajo Nation is very unique in that we provide, like I said, all this comprehensive care. So we take care of kids who have chronic illnesses, and we get to know their families because we live with them. We live in the same community with them. Sometimes we're their soccer coach. Sometimes our kids go to school with them. And so wanting those children and teens to have all the opportunities they possibly can have is what Make-A-Wish is trying to do for them. And so it kind of makes it easy for us to know that those kids are out there and refer them to your organization. And that's sort of the hopeful part of pediatrics and the hopeful part of what we do in small communities to try and be good mentors and just, good examples for kids. I'm very honored because I think it is my privilege to serve these families. How often can you be a very God person to someone, and bring that joy to their life? I've seen these kids who, sadly, sometimes I feel like, all I do is give them bad news, or I have to torture them to get their blood tests. Yet when they tell me I'm going to go to Disney World, or I'm going to get at the biggest entertainment center I've ever seen, stuff that is even beyond their, both economic means, but even just sort of, it's their flight of imagination. The joy that brings to them is amazing. Sometimes you might not think a kid is eligible, but if they have a chronic illness that is impacting their life, consider referring them. It takes me maybe 15 minutes to do the entire thing, including typing up a quick medical summary. And if I can do something that makes their life better, right? Especially if it's filling out some forms, no big, right? Medical professionals like you are essential. Every wish begins with your referral.